after 6 years of steadily escalating agony. Olivia Bland quit making excuses for why she wasn't at work or couldn't make her appointments. Constantly having to admit that she felt horrible became an embarrassment for her. The 37-year-old Albuquerque accountant Bland stated, "I was too embarrassed and tired of saying I felt like crap." She was speaking from personal experience. Bland visited 8 different doctors and went to the emergency room or urgent care 8 times between 2012 and 2018 because of her chronic stomach pain, along with extreme exhaustion. She also suffered from a low-grade fever that would strike in the late afternoon. "I could drink 2 cups of coffee at 9 p.m. and be sound asleep by 10. According to her. Only to wake up 10 hours later still exhausted. A rheumatologist had previously told her he didn't want to see her again and found nothing wrong. So her internist recommended she change her diet. A doctor examining Bland's most recent CT scan, however, found 2 previously undetected problems in July 2018. It would take another year for her to overcome the obstacles on her way to effective treatment. "I feel pain every morning when I wake up," Bland recently stated, taken aback by the lack of discomfort. "I can't even put into words how different it is." From the beginning, Bland's digestive system had been delicate. She was given the general diagnosis of irritable bowel syndrome, a condition that encompasses both gas and diarrhea, when she was 18 years old. But the lower abdominal ache that began in 2012, 2 years after the birth of her first kid, was distinct. The intensity of the pain ranged from dull aching to searing agony. And it worried her that she might have appendicitis. Since Bland had a high pain threshold and had successfully given birth twice without the use of medicines, she usually avoided discussing the subject. An abdominal CT scan, which her physician had ordered, seemed to be normal at first glance. By 2014, a year after the birth of her second child, the pain had diminished. But it had begun to reoccur monthly and would endure anywhere from a few days to a week. Bland went to the emergency room or urgent care multiple times after over-the-counter pain medications failed to alleviate her symptoms. Each time, the doctors were unable to determine the cause. Another visit to Bland's internist occurred in March 2017. The doctor gave the patient acid reflux medicine and made the dismissive remark that all women had stomach ache, even though Bland insisted her suffering wasn't from reflux. The doctor nonetheless left her with a recommendation to improve her diet. She then went to see the nurse midwife who had assisted her with her first birth. The nurse recommended an endometrial ablation, which had supposedly benefited someone with excruciating abdominal discomfort and is generally used to manage heavy periods. Bland had the surgery arranged, but she later canceled it because she was worried it could work out well. She went back to the rheumatologist she had been visiting in November to discuss her possible diagnosis of lupus, an inflammatory condition that produces discomfort and inflammation. To verify her weariness, she took her spouse, Jeff, along to the consultation. Since both her parents and sister had undergone thyroid treatments, Bland also hoped that the tests might identify an underactive thyroid, which can result in lethargy. Bland sobbed when the rheumatologist informed her that she did not have lupus or a slow thyroid. "He looked at me and said, 'You've realized your crime because your blood work is normal,'" Bland stated. "I knew how crazy I looked, but I couldn't handle another negative test." The doctor told her that unless something changed in her medical history, he would no longer be seeing her after she turned down his offer of antidepressants. Bland was having increasingly regular pain attacks, and his family life was taking a hit. When my husband would ask what I wanted for my birthday, Mother's Day, or Christmas, I would cry and say, "I just want to sleep. And that's it. I'd like to sleep for a full day." Her toddler boy imitated a character who walked stoop down and made tiny steps during a game of charades. When the 7-year-old made multiple inaccurate guesses, he joyfully shouted out, "You, Mom." Bland remembers stifling her tears because she felt terrible that her kids had to witness her like this. In 2018, a supportive and new physician requested tests. The bacteria that causes ulcers and celiac disease, a common autoimmune ailment brought on by gluten. Every result was normal. That's when Bland started to doubt her own sanity. Did I require other people's attention? Was I really that indolent? I began to seriously question whether I was truly the horrible person that doesn't play with her kids and hypochondriac that everyone else seemed to think I was. Bland questioned whether she might have a kidney stone in July 2018 after the pain spread to her back. When her internist ordered a urine study, blood was found in it. After that, the physician prescribed a CT scan of her pelvis and abdomen. Bland had previously had scans of a similar nature, but this one turned out to be transformative. Pelvic congestion syndrome and the less common nutcracker syndrome were the two occasionally associated illnesses that the scan indicated Bland had. Varicose veins surrounding the ovaries during or after pregnancy are a common sign of pelvic congestion syndrome. Engorgement of these veins results in a pooling of blood and excruciating discomfort. Nutcracker syndrome is a condition that can be indicated by pelvic congestion and happens. A blockage in blood flow occurs when the left renal vein, which carries blood that has been cleansed by the left kidney, becomes constricted. Nutcracker syndrome, which can strike males as well as women, is not always symptomatic. Blood in the urine and intense stomach pain are symptoms of loin pain hematuria syndrome, an illness that was initially described over 50 years ago but is still mostly unknown. I thought, wow, this is the most incredible news I've ever received, Bland said. Finally, after 6 long years, she found a solution. And it had nothing to do with being insane. A gynecologist, who was not experienced with her condition's treatment, was recommended to her by her internist, an interventional radiologist, whom she subsequently contacted, arrived with the diagnosis. He suggested an embolization, which would involve inserting coils into her ovarian veins to stop blood from collecting. But he warned that it could make her nutcracker symptoms worse. Bland was first unconvinced. "I would cut off my pinky right this second if you told me it would relieve my pain," she recalled telling him. "Sign me up." She had second thoughts after scheduling the treatment, though. The radiologist admitted that he had only ever done brain embolizations, and her family was against the treatment nonetheless. She canceled the treatment online after reading an unambiguous warning on the website of a support organization for nutcracker patients. There she met ladies who had suffered from hematuria or nutcracker syndrome and had undergone kidney autotransplant surgery to alleviate their discomfort. The ureter, which conducts urine from the kidneys to the bladder, and the afflicted kidney are removed and moved to the other side during this significant procedure. Patients who have tried less intrusive methods, such as anesthetic infusions, without success are candidates for this procedure because it does not put them at risk of organ rejection. University of Wisconsin at Madison pioneer and pioneering transplant surgeon Hans's name came up time and time again. After Hans retired and became a professional emeritus in September 2018. Bland contacted him. Following a consultation with the transplant coordinator at UW and an examination of Bland's medical history, it was determined that she would have to take a test that Hans and his colleagues had created to identify potential transplant candidates. A ureteral injection of a local anesthetic is required for this examination. Transplant eligibility is determined by the patient's ability to maintain pain-free status for a minimum of 12 hours. Loin pain hematuria syndrome, Hans wrote in an electronic message, is believed to originate in the ureter, where separated spasms cause pain, similar to continually passing a kidney stone. 3 New Mexico surgeons whom Bland contacted declined to conduct the test. However, she faced an even greater challenge. Her insurance would not pay for out-of-state treatment, and her loving husband was frightened that she was acting hastily to have surgery because of unfounded Facebook rumors. 1 month down the road, the pair had a phone conversation with Robert Redfield III, a transplant surgeon who had been a protege of Hans's and who had just assumed the role of surgical director of the University of Pennsylvania's Living Donor Kidney Transplant Program. He requested to speak with Bland's spouse after she asked him a lot of questions. According to Bland, "Please, don't give up on her and your marriage," he pleaded with him. "This is something we can do to assist her." She claimed that conversation marked a turning point. A few months down the road, during open enrollment, Bland's husband amended their health insurance policy so that it would pay for medical care received in another state. Redfield said that he frequently talks to couples whose relationships are troubled because their loved one is in the transplant waiting process. It's not uncommon for patients to experience significant psychological impact from what they've gone through. According to him, Bland's pain was certainly having a major effect on her quality of life. Redfield claims that over 200 people have been evaluated by the Wisconsin team and that over 4 years, they have performed 80 autotransplants. "We have most likely helped 80 of our patients to reach almost perfect pain resolution," he said. One of the patients with a past of narcotics dependence was a small child on a continuously diluted drip. Redfield claims that following the transplant her medicine demands and suffering were eliminated. The question is whether a transplant can improve their quality of life and if the risk-benefit ratio justifies it. He said, underlining that little study has been done to provide clarity on loin pain hematuria problem. "We still have much to learn about the pathophysiology." Bland went to Madison in May 2019 for the preoperative evaluation. For almost 24 hours, her discomfort vanished. She found out she may have the transplant the day after her 36th birthday. When Redfield gave her the good news, the finest birthday present ever, she remembered thinking. Her insurance company had first declined to pay for the procedure, but they changed their minds after UW Health filed an appeal. Bland had an almost intolerable 2-month wait before her surgery in July 2019. 80% of the time, she was paralyzed with fear that Dr. Redfield would call to inform her that she was no longer being considered for the program. After Redfield's 7-hour procedure, she spent 6 days in the hospital and 11 days at a neighboring residence for transplant patients. It took Bland almost 9 months to fully heal. But at that time, her fever, fatigue, and abdominal pain all went away. "I cannot put into words how grateful I am to Dr. Redfield and his team," he added. "They saved me." After watching the first story above, do you have any thoughts? Feel free to share your opinions in the comments section. Now, let's watch another similar story.
All children deserve love and care, regardless of their appearance. Sadly, Kyle in this tale wasn't able to achieve this. His parents' initial reaction upon seeing him after he was born was devastating, and they ultimately left him behind. You won't believe what happened when Kyle surprised them with a visit years later. As children, everyone has aspirations, hopes, and fantasies. Rita and Steven were not an exception. They planned to have multiple children and were eager to begin a family as soon as possible, but not just any kids would do. Steven and Rita were looking for unique kids with striking features like hazel eyes, lips shaped like hearts, and tall stature. They thought that since they were gorgeous, this wasn't too much to ask. They believed that having children that looked like them would be easy. Rita and Steven, however, were from low-income families. Following high school, they had little interest in getting degrees and couldn't afford to go to college. Rather, their goals were to work, save money, and launch a street food company. They were happy to live in a modest apartment, take care of their children's basic requirements, and maybe take a yearly trip rather than striving for tremendous money or luxury. Steven and Rita believed they had accumulated enough money in their mid-20s to begin a family. Steven worked in a factory, while Rita was employed at a daycare. With friends and family support, they tied the knot. They started trying for a child soon after the wedding, and Rita soon fell pregnant. They discovered they were expecting a son at 18 weeks when they had a scan. Steven shouted with excitement, gathered Rita in his arms, and declared, "We did it. The boy will have my appearance. I will become a father." However, Steven could have behaved differently if he had genuinely grasped the meaning of fatherhood. Everything went well during the pregnancy until one sunny Saturday morning when Rita's water broke. She was wheeled into the labor room as soon as Steven drove her to the hospital. Rita had to undergo an emergency C-section after the doctors discovered that the baby wasn't positioned correctly. Rita felt calm and assured that everything would go according to plan during the delivery. She had no idea that her love would soon be put to the test, and she would unfortunately fall short. A group of medical professionals delivered the baby boy 20 minutes later, and they all gasped when they saw him. Why did the scan fail to pick up on such a crucial detail? In addition to being born with a hunchback, the boy had hypertrichosis, a disorder characterized by an excess of hair on the skin. The parents' responses were shocking, and the child needs love and care. Rita was so horrified by his appearance that she ordered the nurses to remove the infant from her care. "No way, that's not my baby," she yelled out. "What did you do to him?" Even worse was Steven's reply. His lack of empathy toward the child led him to make a fuss in the hospital and place the blame on the medical staff for the baby's abnormalities, although the doctors were embarrassed that the scan had missed such a crucial feature. They promised the couple that they would pay for the operation to fix their hunchback. Concerned about how they would pay for the procedure and the boy's continuing medical care, the couple remained skeptical, rather than experiencing a sense of relief. They were troubled, tossing and turning over nights, consumed by anxiety over how people would view them in the presence of their newborn. Unfortunately, the youngster was sick a lot and had to go to the doctor often. Steven and Rita came to the realization that this was not the life they desired at some point. Their annual trips, business goals, and hopes of producing beautiful children were all sources of anxiety for them. Because they were so disheartened by the turn their lives had taken, they decided to give the boy away in the hopes that he would find a good home. After saying their goodbyes with a kiss and a ride to an orphanage, they disappeared from the boy's life, unbeknownst to them. They would cross paths with him once more in a few years. While he was a youngster, Kyle blossomed into an orphan who was kind, polite, and charming. His looks were the main reason he was never adopted. Unfortunately, Kyle started to think no one would ever adopt him when he was 7 years old. Whenever he had to bid farewell to an adopted companion, he felt anguish because no one ever came to claim them. However, luck finally shone upon Kyle on his 9th birthday, in their late 40s. John and Elizabeth, affluent and childless, made the decision to adopt. Kyle captivated them the moment they arrived at the orphanage. Compared to the other kids, he seemed really down, and we wanted to cheer him up. He had a lot of promise, and we connected with him on a profound level. Our goal was to assist him in realizing his aspirations. Elizabeth quipped, "They lavish love, care, and attention on Kyle after adopting him. Even after they shelled out a big penny to get his hunchback removed, the excess hair on his body still wouldn't budge." Regardless, Kyle was raised by a loving couple who instilled in him a sense of self-acceptance and taught him not to let himself be defined by the views of others. After some time, Kyle was accepted to a college to pursue a medical degree. After receiving his degree, he dedicated himself to saving lives as a surgeon. 3 years later, just as Kyle was wrapping up his shift, he got a call regarding an urgent surgical case involving a man. Kyle quickly changed into his scrubs and headed to the operation room. There was nothing that could have readied him for what lay next. Kyle froze when he walked inside the operating room. The patient's eyes, nose, and facial structure were strikingly similar to his, though they saw the resemblance. The other surgeons said nothing. After 5 hours, the procedure went well. When Kyle walked to the waiting area to tell the man's wife the good news, he was in for an even bigger surprise. The woman, Kyle realized, looked a lot like him, especially in the eyes. Even worse, the woman cried and jumped up in fear as soon as she noticed Kyle. Kyle just glanced at her, perplexed and not sure what to say. After a while, the woman said she was sorry for her response and said, "Your appearance made me think of my son, who also had a hunchback and excess hair. We gave him up, and ever since, my husband and I have regretted being such bad parents. Who knows, our son might have followed your path and become a doctor." They had failed to conceive any more children. The woman spoke for a moment, and then Kyle hurried home, his heart pounding with eagerness. Was this the child to whom she had been alluding? Did the pair give up on their son for this one, after telling his adoptive mother everything? Kyle went to the orphanage with her to verify his concerns. He was correct. He was the biological son of the woman who had been sobbing in the waiting room and the man on whom he had performed surgery. When Kyle went to see Stephen in the hospital 2 days later, he also got to meet Rita. His pulse was racing as he walked up to the couple, and he was having trouble controlling his tears. "You need to forgive yourselves for what happened to your son," Kyle said to them when he got close enough. "I think he has pardoned you, so go on and enjoy your life." Then he gave the pair a hug, and just as a tear started to fall down his cheek, he wiped it away before they saw. After then, Kyle left the room without turning around. He believed it would be best to keep his identity from his birth parents a secret. He was unwilling to reopen past hurts. Despite his gratitude for the opportunity to meet them, he made the decision to put the past behind him and concentrate on the future. After watching the stories above, do you have any thoughts? Feel free to share your opinions in the comment section. If you enjoyed our video, please like, subscribe, and share our channel. That's all about today's stories. See you next time.